Hi everyone, my name is Julia DeHart, and today I will be discussing the classification of behavior into respondent and operant. So, these two categories are the most important concepts in behavior analysis because they help explain why behavior occurs and how behavior changes over time. Although both types of behavior are influenced by the environment, they differ in how they are controlled. Understanding this distinction allows behavior analysts to accurately assess behavior and develop more effective interventions. Behavior analysts classify behavior into two broad categories: respondent and operant. Respondent behavior occurs automatically in response to a specific stimuli or stimulus, whereas operant behavior is influenced by its consequences that follow. Distinguishing between these two types of behavior is essential because it helps explain whether a behavior is occurring because of an immediate environmental trigger or because it has been reinforced over a period of time. This understanding guides assessment and treatment decisions in a variety of settings, including education, healthcare, and of course, the field of applied behavior analysis. Respondent behavior is a behavior that is automatically elicited by an antecedent stimuli or stimulus. These behaviors are involuntary and they usually occur without a conscious thought. They are controlled by events that happen before the behavior rather than by its consequences that follow. Many respondent behaviors are reflexes. For examples, we have increase in heart rate after an intense workout, flinching when you hear a sudden loud noise, or blinking when something approaches your eye. Respondent behaviors can also be learned through classical conditioning. For example, someone who has had a painful medical procedure may begin to feel anxious by just walking into a doctor's office. That's because that environment has now become associated with discomfort. Understanding respondent behavior is important because it helps behavior analysts, especially future behavior analysts, recognize emotional and physiological responses that may influence other behaviors. Operant behavior is different because it is emitted rather than automatically elicited. Operant behavior occurs because they have produced certain consequences in the past. If a behavior is reinforced, it is way more likely to happen again, whereas if it is punished, it generally becomes less likely to occur. Some examples of operant behavior is working overtime to earn extra pay, studying for an exam to achieve a higher grade, and participating in an event to receive social praise. Behavior analysts often explain operant behavior using the three-term contingency, which includes the antecedent, the behavior, and the consequence. Now, I remember when I was first starting out in the field of ABA and I was taking ABC data for the first time, and I think just the word consequence in general kind of makes you think of something negative or bad, whereas the consequence is literally just what happened after the behavior. So it's not necessarily good, not necessarily bad, it's just whatever happens. And the antecedent tells us what happened before a behavior occurred, the behavior is the behavior, and the consequence is what happened after the behavior. A real-world example of this could look like this. I'm in my car driving and I see a sign for Taco Bell, that's the antecedent. I pull in the drive-thru and order my food, the behavior. I then go home and I eat my Taco Bell, that's the consequence. This framework is one of the foundations of behavior analysis and helps behaviorists analyze and identify functions of behavior. Although respondent and operant behaviors are different, they frequently occur together. Respondent behavior is elicited by environmental stimuli and is generally reflexive, which means that the behavior is automatic or involuntary, while operant behavior is learned and influenced by its consequences. For example, before giving a presentation, someone may experience nervousness and an increased heart rate. Those are both respondent behaviors. However, continuing to practice the presentation because previous practice led to positive feedback is an operant behavior. Recognizing these differences allows behavior analysts to better understand complex behavior. Understanding both respondent and operant behavior is essential for a future behavior analyst. Correctly identifying the function of behavior helps determine which intervention is most appropriate and will be most effective. Respondent behaviors may require strategies such as exposure, while operant behaviors are often addressed using reinforcement, prompting, shaping, or consequence-based interventions. Although many everyday behaviors involve both respondent and operant processes, distinguishing between them provides a foundation for effective assessment, treatment planning, and long-term behavior change, which is always the goal. By understanding these classifications, behavior analysts can make informed decisions that improve learning, skill development, and overall the quality of our patients' lives. Thank you all for listening, and I hope that this breakdown of respondent and operant behavior helps make the two categories more clear and understandable.